Oppositional defiance is something we do see in children with ADHD, and this can be very difficult for patients or parents of patients to manage. And the reason is combined with this impulsivity is also this oppositional component here. So it's kind of a double whammy. This is one where I would recommend individual therapy for the child, because oftentimes there is a self-esteem issue that's driving this, some form of depression that's driving this. Oftentimes we'll see some history of emotional trauma that becomes unearthed when a counselor begins to speak with that child. And so the other thing is the label of oppositional defiance needs to be very, very cautiously given and explained to the child as well, because once they identify themselves as an oppositional kind of person, or that's their personality is oppositional or defiant, it really sets them up for failure in some ways. So, this needs to be very carefully disclosed. It needs to be very carefully managed by a team of people who know what they're doing. And it needs to be treated with compassion, and it needs to be on their level, and it needs to be one where the child feels respected and heard and even has a voice in their treatment. Because if through opposition already and we're going to force them to take a medication, or we're going to force them to do a certain thing, that's going to backfire on us. So if the child's old enough, we employ some things like active listening, some motivational interviewing skills to help them understand where they're at. I think this is something that is absolutely manageable, but if in the wrong hands, it can be really devastating if managed incorrectly.